this is the hardest part. I have personally tried multiple preps just to know what it's like for someone to go through it. No prep is great. All right. I am not going to sit here and lie to you and say they taste great. You wish you could drink this every day. That's not going to happen. But nothing is more important than the prep, because if your prep is poor and I cannot see, I didn't do you a great service. I may have done you a small service to say, listen, you don't have a large mass in your colon. That I can tell you. Do you have 2 or 8 polyps sitting in your colon? I can't tell you that. So I'm going to make you come back, and I'm going to make you try a different prep next time. So it's important to kind of try to do your best getting through that prep. The air component that we pump in, we try to limit the amount of air we're pumping in, and but we do wash a lot. We have an irrigation system. We try to wash as much and suction out as much stool to make it so I feel comfortable that I have done the best I can for you that day, and your next colonoscopy is years away rather than months away. Within the last 5 years, absolutely every insurance company has a policy that if you meet guidelines either before the age of 50 based on family history or at the age of 50, you are covered for a screening colonoscopy. In the room itself, I am, and everybody is different, but I'm basically communicating with all 3 people fairly frequently. The anesthesiologist and I, or the anesthesia person and I, are talking, listen, they're moving more, they're uncomfortable, or sedation's too deep. So we're in constant communication. They're looking at vital signs. They're examining the patient. They are really the head of making sure that the safety aspect is there. And that's what we like to have, 2 personnel monitoring safety. The nurse is there to aid me with, are the vital signs okay? If I need a little pressure, sometimes we push on the abdomen to kind of keep the colon from moving so I can get past a certain turn. Therefore, again, safety is the ultimate. And then I have the technician in the room who is helping me with whether a biopsy needs to be done, or if I need to irrigate something, or I need to remove something with a polyp technique. So all 4 of us are in continual conversation, but it's all related to patient safety, or is there anything we need to do to make sure that this is as good as it can be for that moment for the patient.